I just wanted to take a few minutes to go over oxygen modalities in titration and weaning of oxygen. So we're all familiar with the oxygen, the nasal cannula. It should be used at 0.25 and it can be used up to 6 liters, and it can be hooked up to humidification once you're at about 4 liters. However, if you have a patient that's been on long-term oxygen and remains in the hospital, you may want to humidify it at a lower level of 2 or 4. It just really makes them more comfortable and they don't have any skin breakdown inside the nose. The next type of oxygen modality that you may use, but you may not use, is a simple face mask, which I do not have here, but it's similar to the non-rebreather. What you need to be cautious of when you're using a simple face mask is because it's in an enclosed system, similar to the non-rebreather, if you do not turn the oxygen level up high enough to probably at least 6 or 8 liters, the patient can rebreathe that oxygen that's already collecting in the bag, and they can become hypercarbic. So we actually don't recommend that you use simple face masks because sometimes there's untoward effects as a result of them. The next one that you may be familiar with, particularly when patients are decompensating, we'll put our patients on a non-rebreather, so which I have here. You hook it up to the wall. You can hook it up to 10, 12, 15 liters. When you do hook it up, you want the bag to inflate at least halfway, but not all the way. It doesn't have to be fully inflated, and then you apply this to the patient. There's a misnomer to this mask. It's called a 100% non-rebreather, but that's not really what it delivers. It'll probably deliver with a good seal up to 90 or 94%, but it truly does not deliver 100% non-rebreather oxygen, so be aware of that. With a nasal cannula, be aware that if a patient is a mouth breather, we're giving them oxygen through the nares, but they're not actually breathing it into the lung. It's also dependent on the depth of their breath. So again, the non-rebreather we would go to next. If you have a patient that does need a nebulizer treatment, you can hook your nebulizer treatment up to this, and you can separate the mask and apply this system to the bottom of the mask, and then apply your oxygen to it, because sometimes patients will need to maintain that higher level of oxygen, and you can, rather than take the mask off and give them a non-rebreather treatment, you can hook it into the existing mask. I did want to take a moment to talk to you about the venti mask. So with the venti mask, you need to know that it comes in different parts, and you can titrate the oxygen levels based on, we're going to have to stop it.